So good evening, everyone, and welcome to today's webinar on innovative approaches or strategies, to promoting physical activity in young people in the Caribbean. My name is Abby Bejo, and I'm the program director at Lake Health and Wellbeing, which is a public health NGO in St. Kitts and Nevis. And this webinar is a partnership between ourselves, the Healthy Caribbean Coalition, the Caribbean Public Health Agency, and the Pan American Health Organization. So today's topic is very important because we know that physical inactivity is a risk factor for non-communicable diseases, which continue to place a significant burden on our countries across the Caribbean. So if we are to make progress in tackling NCDs, as well as everything else that we do in terms of trying to tackle NCDs, we also have to tackle physical inactivity, especially among young people, the next generation. And so to do this effectively, we need to move beyond traditional approaches and think differently about how we can engage and inspire young people to move more. So at the same time, whilst we're thinking about all these creative approaches, we also need to think about how we can be inclusive in these approaches. So we want to ensure that all young people, regardless of whether they have a disability or not, regardless of their background, their gender, their circumstances, they can also participate in physical activity programs. So we're hoping to tackle a lot of these issues today, and we're so grateful that you've joined us. So just to give you some information about the structure of the webinar, so we have some fantastic speakers for you, and the webinar will be divided into three sort of portions. The first part will be opening remarks from key partners. We'll then move into some presentations, and then we'll finish up with a panel discussion. After the presentations, in the second portion, we'll have a Q&A, and then after the panel discussion, we'll have a Q&A. You can put your questions into the Q&A box. Your comments or anything that you'd like to say or share can go into the chat. And of course, you'll get the recording of this session soon after today. So we'll make sure that you get the recording of this session soon after today. So thank you all for joining us. We're looking forward to a really great discussion today. And we're just really excited about this discussion because we know a lot of times physical activity is not always discussed. So we're really happy to have this discussion. So without further ado, I am going to move into the first portion of the event, which are the opening remarks. And I'm very pleased to welcome Mr. Othniel Lamont, who is a physical therapist and a Healthy Caribbean Youth member, to give his opening remarks. So over to you.
Hi, good evening, everyone. So, on behalf of Healthy Caribbean Coalition and its youth arm, Healthy Caribbean Youth, I welcome you to our discussion, innovative strategies for promoting physical activity in young people in commemoration of World Physical Activity Day in partnership with Lake Health and Wellbeing, CARFA, and PAHO. To begin, let me provide some context for our discussion today. Currently, overweight or obesity affects 1 in 3 children in the Caribbean, risking classrooms, communities, and futures. Additionally, non-communicable diseases, NCDs, many of which are preventable and linked to physical inactivity, causes 75% of deaths in our region. Building on this, physical inactivity in the Caribbean continues to rise. We are failing to meet global targets, and projections indicate inactivity could reach 40% by 2030. Given these worrying trends, what does this mean for daily life? Well, we spend more time on screens and less time playing. We sit more often than we move. Stress, anxiety, and burnout impact young people at increasingly younger ages. Movement no longer comes naturally in daily life and now requires intentional incorporation. Many young people encounter barriers such as limited safe spaces, digital distractions, and rising temperatures from climate change, which make outdoor activity more difficult. Despite these challenges, optimism persists. And together, we will solve this issue. Physical activity is a powerful tool. It improves mental health, enhances academic performance, builds confidence, and saves lives. Importantly, it requires creative, inclusive, and bold approaches rather than costly solutions. Today, our goal is clear: drive real change in youth physical activity. We aim to turn awareness into meaningful change, seek to transform policies into effective practices, Let's move directly from discussion to taking meaningful action. As we engage this evening, I urge each of you to not only share your perspectives and ideas, but also commit to concrete action. Together, let us identify and pledge specific ways to redesign spaces, schools, and redesign spaces, schools, and systems so that movement becomes the easy choice for young people, whether it's supporting active transport, promoting school-based physical activity programs, advocating for safe community spaces, or pushing for policy changes that prioritize movement. Your actions matter. But by actively contributing and following through, we can foster ownership and drive true community-led change. Launching innovative school programs or supporting local initiatives, you directly promote physical activity and help protect an entire generation. After this event, I challenge you to act. Start a conversation with a young person about movement, organize a short community walk this week, or initiate a new activity. Immediate and visible actions from each of us will build a culture of activity and help others follow our example. Thank you.
Sorry, wonderful. Thank you so much for your remarks. We really appreciate it. And it's so nice to get a youth perspective as well. So we thank you so much for your remarks. So we're now going to move on to our next speaker who's going to provide some brief remarks. So that's Dr. Heather Armstrong. Dr. Heather Armstrong is the head of the Chronic Disease and Chronic Disease and Injuries Department at CARPA. So over to you.
Thank you so much for your introduction, and good evening to colleagues and partners. CARPA is certainly happy to be part of this webinar, looking at innovative strategies for promoting physical activity in young people. And we extend sincere thanks to our partners, Lake Health and Wellbeing, in partnership with Healthy Caribbean Coalition and the Pan American Health Organization, for bringing us together on this important occasion in recognition of World Physical Activity Day. Across the Caribbean, we face a growing burden of childhood obesity, NCDs, and mental health challenges among our young people, and these issues are interconnected and they require integrated, practical solutions. Physical activity is one of the most effective tools we have, yet many of our young people are not sufficiently active, highlighting a critical gap between what we know works and what is being achieved. This session is therefore both timely and action-oriented. As we examine key global evidence, including insights from the WHO Global Status Report on Physical Activity, while also learning from Caribbean experiences, what has worked, what has not, and where we must go next. We will also explore emerging challenges, including the impact of climate change on opportunities for physical activity. Importantly, this discussion is not only about innovation and implementation, how we translate policy into practice, create supportive environments, and engage young people in meaningful and sustainable ways. Addressing this issue requires collective action. No single sector can do this alone. Strong partnerships across health, education, communities, and beyond will be essential to driving progress. I encourage you to engage actively, reflect on your context, and consider how the ideas shared today can be applied in your own settings. The health of our future generations depend on the actions we take now. Thank you, and I look forward to the discussion.
Wonderful. Thank you so much, Dr. Armstrong, for your remarks. We really appreciate it. And now we move on to Dr. Gloria Geraldo, Advisor for NCDs and Mental Health, the Caribbean Sub-Regional Program of PAHO. So over to you for your remarks. Thank you so much.
Thank you. Thank you. Good evening, colleagues and partners. It is a privilege to welcome you on behalf of the Pan American Health Organization to this important discussion organized by civil society and international partners as well on physical activity, an issue that sits and we hope it stands. So I am using my standing desk, so I will try to move during our session today. This issue sits at the intersection of health, development, and resilience in our region. Physical activity, as our colleagues have mentioned, is not a lifestyle choice. It is a foundational determinant of both physical and mental health. The scientific evidence is clear. Regular physical activity reduces the risk of cardiovascular diseases, diabetes, cancers, depression, while improving cognitive function, well-being, and overall quality of life. Yet, as we know, in the Americas and in the Caribbean, too many of our communities, particularly youth and adults, are not meeting the recommended levels because our lives have simply just been designed to be much more sedentary. And so it is not lack of awareness or motivation. It is the result of the environments that do not allow us to make the healthy choice, the easy choice. But today we're here to expand the ways we think about physical activity. It's not just about sport, recreation, marathons. It is about the way we design our societies. We design our houses, we design our cities, we design our schools. Do our communities enable safe walking and cycling through active transportation? Do cities incorporate green spaces? Are our cities climate resilient infrastructure? Do they have climate resilient infrastructure that invite movement? Do urban planning and architectural decisions prioritize people over vehicles? So we hope to get you thinking about all these questions during our webinar. In our region, increasingly affected by climate change, we also need to be thinking about sustainable solutions such as shaded walkways, resilient public spaces, and integrated transport systems. The evidence from WHO and PAHO highlights that the most effective interventions are multi-sectoral. They have to bring in people from transport, from education, from housing, from the environment, and from health, working together. This is not a responsibility of one sector or one ministry, but a whole of government, and indeed of a whole society. It is shown today by having civil society leading the organization of today's webinar. So we hope the webinar is an opportunity to move from evidence to action, to share experiences, to challenge our assumptions, and to identify practical pathways forward that are grounded in the Caribbean reality. Let us approach the conversation with enthusiasm and a clear vision so that every person in the Caribbean, regardless of where they live, have the opportunity to move, to thrive, and to live well. Welcome and have an amazing webinar.
Thank you so much, Dr. Geraldo. We really appreciate your warm welcome and your warm remarks. And thank you so much to all of our partners who just gave us some welcome remarks. So we really appreciate you. So now we're going to move on to the second portion of this event, which is going to be some educational presentations. So our first presentation comes from Dr. Audrey Morris, who's the Regional Food and Nutrition Advisor at the Pan American Health Organization. And Dr. Morris is going to talk to us about the status of physical activity in the Caribbean with a focus on young people. So over to you, Dr. Morris.
Okay, can you hear me and can you see my presentation?
Yeah, we can hear you loud and clear and we can see your presentation.
Okay. All right, so good afternoon, everyone, and I'm happy to be here representing PAHO at this webinar. A lot of the information that we have is on adolescents, so I'll present on that. And we do know that there are other young persons as well, younger adults as well. So I did bear that in mind as well. All right, so what are the recommendations that WHO has for physical activity in children and adolescents? Is that they should be doing at least an average of 60 minutes per day of moderate to vigorous intensity, mostly aerobic physical activity across the week. And the vigorous intensity aerobic activities, those should also be incorporated at least 3 days a week. And these are strong recommendations supported by evidence. For adults, it's recommended that all adults should undertake regular physical activity, at least 150 to 300 minutes, moderate intensity, or 75 to 150 minutes of vigorous intensity aerobic physical activity, or a combination throughout the week for substantial health benefits. And there are greater benefits with the more that you do. Adults should also be doing muscle strengthening activities 2 or more days a week. What is actually happening though? Global estimates indicate that over 80% of young people are not meeting the global recommendations of 60 minutes of moderate to vigorous physical activity per day. In the region of the Americas, we have found that physical inactivity ranges from 72% to 89% among the countries that we have information for. And more females than males are physically inactive. Over the past couple of decades, though, while there has been a slight improvement among boys, for girls there has been no improvement, and in fact it's worsening in some countries. So that's the situation that we have. What do we do about it? In response to the growing problem of physical inactivity, WHO launched a new global action plan on physical activity. So, the vision of this plan is more active people for a healthier world, and the mission is to ensure that all people have access to safe and enabling environments and diverse opportunities to be physically active in their daily lives as a means of improving individual and community health and contributing to the social, cultural, and economic development of all nations. Now, the target of this action plan is a 15% relative reduction by the year 2030, using as a baseline 2016, what the situation was in 2016. So a 15% reduction by 2030. The plan has 4 strategic policy areas: active societies, active environments, active people, and active systems. So there are actions, and I'll invite you sometime to look up the plan. There are actions under those 4 strategic policy areas. There has been, of course, once you have developed a plan, you have to see what is happening with it. So there have been 2 major global reports on physical activity that WHO has published. The first publication that you see, the one on the left, shows you from the cover that the world is off track for 2030. So that 15% reduction in physical inactivity that we spoke about, the world is off track. The other publication, the Global Status Report on Physical Activity, presents the global progress on implementation of the recommendations in the plan. I mentioned that there are the 4 action areas. So looking at the active systems, this graph is showing the countries with a national standalone physical activity policy, strategy, or action plan. You'll see the second set of bars there, the region of the Americas. So it seems there that in terms of this national physical activity policy or strategy, this region is a ways behind. So in this region, however, we have tried to dive into what is actually happening. Why are we so behind, or what is the situation? So we found in this publication food, nutrition, and physical activity initiatives in schools in the Caribbean. So this again has a focus on schools. We found that 88% of countries have a national policy, strategy, or plan of action on NCDs, which includes physical activity. 97% of countries are monitoring physical activity in adolescents, but only 48% of our countries in this region have national guidelines on physical activity, especially for younger persons or adolescents. 30 countries have some kind of policy relating to enabling environments. So virtually all the countries have some form of national or state regulation about speed limits, for example, because that's important when people want to be walking on our roads. Most countries have national or state regulations on drinking and driving. All of them have some regulations on drug use and driving, and most regulate mobile phone use. However, just 37% of our countries have separate infrastructure for pedestrians and cyclists for them to safely be using the roads. Most countries encourage physical activity through community-based actions and sport initiatives, and in open public spaces, including parks, and through walking and cycling events. One of the things we would have wanted to get from when we collected data for this was how much promotion of physical activity in schools there is through quality physical education, but that information was not available. So then, recognizing that there's no single policy solution, as Dr. Geraldo mentioned, there has to be a multi-sectoral approach. And this here shows the whole of government solutions for physical inactivity in support of the plan, the Global Action Plan on Physical Activity. So it's a systems-based approach that recognizes the interconnectedness, the adaptive interaction of multiple influences on physical activity. So there are numerous opportunities for policy action by the different stakeholders to reverse the current trends in inactivity.
Sorry to interrupt. 2 minutes left.
Yes, and I'm wrapping up. I'm just on time. So the implementation requires a collective and coordinated response across the settings where people live, work, and play. We have to bear all of that in mind for all the relevant stakeholders at all levels to ensure a more active future. And this is my last slide, and it is just pointing out to us all when you get to a point of decision. So you see the elevator, you see the steps are just a few steps away. What do? It's a point of decision, but we can expand this, not only in our personal lives, but when we are all planners, we are policymakers. What do we do? What do we consider? And thank you.
Wonderful. Thank you so much, Dr. Morris, for your presentation. Very interesting to hear about the gender differences around physical activity. So that's one to bear in mind in terms of making these policies and programs more inclusive to ensure that girls and boys are able to participate in physical activity. So thank you so much for your presentation. So we're now going to move on to our next speaker. So our next speaker will be Dr. Heather Armstrong, the head of chronic disease and injuries at CARPHA. And Dr. Armstrong is going to talk to us about physical activity policies and programs in the Caribbean. So over to you, Dr. Armstrong.
Thank you so much. I'm just going to share my presentation. All right, so my presentation will quickly look at this question that we have: how do we get Caribbean children moving? And I want to thank Dr. Morris for sharing with us those key points of information in terms of looking at what's happening with physical activity among our adolescents and noting that there is a gender disparity. Our young ladies are not engaging in physical activity as much as we would want them to. And as you can see, it has gotten worse if we compare the number from 2001 to what numbers we have now. Basically, we're losing ground in the Caribbean, and that has some implications for us because we know that where there's physical inactivity in our children, that translates, unfortunately, to physical inactivity in adults. So the question is, why should we focus on our children? It's important because of four big reasons. We know that it's habit forming, patterns set in childhood persist for life. We're also aware that school can reach everyone despite their economic status, their background, where they live. For 13 years they're in school and they can be reached. Also, in terms of the issue with obesity, it continues to rise within the Caribbean, and it means that our numbers are exceeding that within the global averages. And of course, the four thoughts about prevention, noting that every dollar spent in physical activity can be seen as an investment case as opposed to an expense line. And therefore, it's important that we use this leverage to address physical inactivity in our population. So when we talk about the policy landscape regarding what has occurred within our region, we know that there have been several declarations, several agreements that have forged a path for us in terms of where we're going. So we're not coming from nowhere. We talk about the Port of Spain Declaration. We also know about the World WHO Global NCD Action Plan. And it just shows us over 2 decades of political commitment. And the problem is we are missing the operational vehicle to translate commitment into action across every member state. And that's where I'll come to talk to you about Caribbean Moves as this one of the operational vehicles. So Caribbean Moves is a whole of society gender responsive model, and it was developed through consultation across 4 member states. And there was also consultation with other sectors, with other regional countries to help us understand how do we address physical inactivity in a concerted way. And the model rests on 5 pillars: behavior change, communication. It speaks to governance, monitoring and evaluation, and finance and resource mobilization. Each pillar having a specific part to play in helping us build sustainable ways of encouraging physical activity within our countries. It is built on a nested socio-ecological model where the child is at the center, but a child doesn't change behavior in isolation, as we heard before. They're shaped by interpersonal relationships, organizational settings like schools and the wider community, and ultimately by public policy, and each layer has to move together. So what are some of how does the model work in practice? So we talk about promotion of healthy lifestyles and 3 behaviors moving in concert, tailored to the Caribbean's behavioral, social, cultural, and economic landscape. And we talk about moving, that's the physical activity we are focusing on today, promoting regular activity through community-based programs and public health awareness campaigns. And of course, connected to that is encouraging healthy eating and having your regular health checks. The second part looks at promotion of supportive environments. And this is reiterating again what we've heard before. Behavior change is not only sustainable when the context around the child supports it. Where we live, work, and learn shape what we do with our bodies, and therefore is a mutually reinforcing system. So let's talk about some of the activities that have been happening in some of our member states. We know that there are lots of health promotion initiatives that have been launched, but we look at Jamaica Moves as one of the flagship countries. They would have started the Moves concept, and from their action, other countries were able to build their own local moves, building it according to the context of their countries. And as you can see, you have various ways of encouraging physical activity and healthy living. So in terms of why we're stuck and where we're stuck, we recognize that endorsement is not enough. And there are several barriers that are presently there that impact our ability to move forward, such as competing curriculum priorities, the digital shift that we heard about. Most people are in front of their mobile device and they do not engage in physical activity, under-resourced health promotion, We would like to do a lot more initiatives, but unfortunately, sometimes the funding is not there. We have to deal with unsafe and absent infrastructure that supports us engaging in our children engaging in physical activity, fragmented information about what's happening, and unfortunately, there's some inequity in terms of we heard about our girls, children with disabilities, and other issues. So in terms of successes, we know that we endorse, we align, and we're delivering. And this just shows us some of the key sectors or key actors that help to make sure that we have that political will to move forward. And that is a success because we know that we have the decision makers behind us in terms of helping our children to engage in more physical activity. So what are some of the lessons learned? It's always important to learn from what has gone before. And whilst we were developing the Caribbean Moves framework, we would have engaged with 4 countries. And these are some of the key things that came out in terms of things that can assist us in encouraging or supporting our children to engage in more physical activity. Policy without delivery fails. Declaration transit to children's lives only when paired with funded implementation and making sure that there is some training and accountability. Schools are our highest leverage setting. Champions matter as much as framework. So we need those persons out there championing the cause, helping our children to make those healthy decisions. And equity must be designed in and not as an additional thought. So the path forward in terms of where we need to go, I want to leave you with 6 words: mandate, invest, regulate, measure, finance, and include. And it all addresses some of the challenges I mentioned before, because in addressing these challenges, we shouldn't see them as challenges per se, but rather opportunities that we can make changes that can support our children and engaging in more physical activity, which we know will make a difference in their overall health and, of course, in the health of our population. So with that, I say thank you. And I just want to remind you, let Caribbean children start moving and be part of the solution. Thank you.
Wonderful. Thank you so much, Dr. Armstrong, for your presentation. Very informative. Really great to hear about Caribbean Moves. So thank you so much for that. And also, I guess, interesting just to think through the lessons learned as well. And I think a key lesson learned is always around implementation and funding. And so I think this is something that we really need to consider if we're to make sure that we're successful when it comes to implementing a lot of the ideas that we have around physical activity, particularly if we're trying to be creative. It really does need that sort of political will, the policies, the funding as well. So thank you so much for your presentation. So the next presentation is going to be maybe a bit different, interesting. It's from Dr. Hospitalis, the founder of Earth Medic and Earth Nurse Foundation for Planetary Health. Unfortunately, he couldn't be with us live, but he has recorded his presentation. And sorry, Dr. Hospitalis is going to be covering climate change and physical activity, and looking at the impacts, the risks, and the opportunities that we have. So over to Danielle to start the recording.
Good afternoon. Thank you for inviting me to present on the occasion of this webinar on innovative strategies for promoting physical activity in young people in the Caribbean. My name is James Hospitalis. I'm the founder and executive director of Earth Medic and Earth Nurse Foundation for Planetary Health. We're based in Trinidad and Tobago and cover the Caribbean and beyond. Today I'm going to talk about climate change, physical activity and sport, some of the impacts, the risks and the opportunities that we face. As I get started realizing my head's going to be covered by the logo, I wanted to just take a moment. Our logo comprises, at the center is the earth in green with a white cross, which is the universal symbol of first aid, because the whole planet is under stress. And it's surrounded by the feeder bands of a hurricane, indicating the powerful changes that are gripping the planet. So today I'm going to talk a little bit about climate change and how it's reshaping physical activity and sport. It's affecting our health, the infrastructure for sports and physical activity and participation. And it contains a lot of risks, but it also has some opportunities. Heat stress. is something we all feel, how you're feeling hot, 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 as the calypso goes. And rising temperatures increase the risk of heat exhaustion and heat stroke. And we must remember that the physiological limit for heat, 35 degrees Celsius, after several hours at that level, you're going to be really dehydrated if you don't stay hydrated. High humidity also limits body cooling, and we're aware of this when it's very hot, and then you get a bit of rain, and it gets really that wet heat, and you feel as if you're going to die from it. I want to draw attention to the heat index, which is the combination of the actual temperature and humidity, and point out that that is rising faster than the actual temperature. So sometimes the temperature may be 32, 33, not uncommon. And if the humidity is in the 80s, then the heat index is in the 40s or as much as 50. This affects athletes and the general population, of course. In fact, there's been a recent study published last month that reduced physical activity due to global heating can lead to a rise in health issues and an anticipated 500,000 extra deaths annually due to physical inactivity, because we know that physical inactivity is a risk for several health problems. Reduce physical activity. If you have extreme heat, it discourages outdoor activity. And just in the last few days here in Trinidad, we seem to have switched into the heat season, and people bawling for the heat and don't want to go outside. It increases, therefore, the risk of a more sedentary lifestyle, and this physical inactivity increases the risk, as this audience would know, of overweight, obesity, diabetes, heart disease, cancer, and mental ill health. Air quality is another accompaniment of the changing climate and wildfires, more and more bushfires in the Caribbean, certainly here in Trinidad where we are. Those worsen air pollution. Sahara dust increasing over the last few decades and worsening air pollution, PM 2.5 in particular. This reduces your exercise capacity if the air is polluted, and it increases respiratory diseases, particularly asthma and cardiovascular disease. And this picture here shows the view from our house in just north of Port of Spain, off Port of Spain, on a bad Sahara dust day. This is not Beijing or Bangkok. This is Trinidad on a bad Sahara dust day. And in the foreground, you see the savannah, where a lot of people exercise. Thousands of people every day exercise, walking or jogging or biking. And on a day like this, it would not be too good for your exercise routine. Unfortunately, these are now over 100 days a year we have that are like this. Climate also, with extreme weather causing more floods and damaging hurricanes, damage sports facilities and grounds. You get more frequent rain. You only have to, if you're a fan of cricket, you realize how many games get postponed, cancelled, delayed because of rain. And sea level rise can also affect coastal venues, and all of this disrupts community sports as well. So this was this week's Earth Medic and Earth Nurse column in the Trinidad Guardian by young West Indian professional cricketer Abhijay Mansingh, and he was looking at why the game must fight for a greener future if it is to survive, given the amount of disruption of matches that take place. This is a great article. It has a lot of practical advice as well on what can be done to combat this problem. This is part of our attempt in Earth Medic and Earth Nurse for the last 18 months to help readers be better equipped to face the climate and health crisis. Climate and the impacts I've been describing, the exposures, affect performance. It reduces endurance and increases fatigue, particularly for long distance events. And there's a higher injury risk as a result, and so we need heat adaptation studies. Now, I declare a bias that I like physical activity, and that's some pictures, some shots of me there taking part in the Grenada Triathlon a few years back, swimming, riding and running, and posing with all the young people. I was the oldest guy. I came second in my age group. I was quite pleased. in Grenada. This is a great triathlon if you've never done it. One of my dreams is doing the Nevis to St. Kitts swim, maybe next year. There are opportunities in the face of these challenges that we have opportunities with active transport. We can promote walking and cycling infrastructure. And people say, but Doc, it's so hot, how are you going to do that? So one of the things is to have urban greening accompanying the walking and cycling infrastructure developments. And this helps to reduce emissions and improve health, of course. It's a win-win if you can increase biking and walking as alternative transport. And there's co-benefits to tourism, since we're mostly tourism-dependent economies. And I draw attention to the Basté St. Kitts Urban Resilient Plan. I met with some of the folks about 2 years ago, and they, 18 months ago, they have quite a good plan for heat reduction in Basté, which involves greening, it involves painting roofs white and so on, to make the environment more friendly for physical activity. Climate smart infrastructure is another avenue. The picture on the right is a green corridor in Bogota. And since they've done these sorts of developments, there's been a big increase in physical activity noted in the population. They also have ciclovías, where you block off 5 kilometers or a couple of kilometers of road, typically on a Sunday, and thousands and thousands of people come out. Security is another concern for physical activity, and when thousands of people come out, you find no hay bandidos. The bandits disappear because there's security in numbers. Things like more heat-resilient design, ensuring shade and cooling is important, flood-resistant facilities, urban green spaces I've already mentioned. And then I thought, swimming in the sea could be an opportunity for us in the Caribbean, with due consideration for safety, that kids learn to swim before they jump in. Adapting sport formats is another way. If you follow cricket, there have been a lot of changes in the timing of the games to morning or evening into the night when the temperatures dropped, adjusting for the seasons, modified game formats, ensuring hydration and shade is a constant issue. Acclimatization. If kids are in a cool classroom, or some who are in better off schools are in an air-conditioned classroom, and they suddenly go out on sports day and they're running around for hours, they're at greater risk of heat exhaustion and heat stroke. Digital and indoor fitness are some of the ways in which physical activity can be promoted among youth to encourage physical activity. Let me conclude a few policy and practice recommendations. Investing in climate resilient facilities and early warning systems. And our ministries of health and governments need to insert some of these proposals into the NDCs. That's the nationally determined contribution and then the main national plan for responding to climate change. And I reviewed 16 NDCs last year from Caribbean countries, and all but one of them, well, they all mentioned health, but only one had a specific proposal with funding requested for dealing with, and that was a greening proposal. So we have an opportunity there to latch on to these NDCs. Promoting active transport. And I remember Prime Minister Harris used to have a walkabout his constituency. And I contacted him one day and I said, PM, why don't you promote walk to school days? And he said, that's a good idea, Hospitalis. So it's something to think about in our countries, that promoting walk to school and walk to work days could be something to consider. Integrating health and climate policy, using sport for public engagement are some of the other ideas for this. Let me draw your attention to a key resource from our Caribbean Research and Action Agenda for Climate Change and Health, and that is Chapter 15, on climate-friendly, health-promoting infrastructure. So thank you very much. I hope that this is useful for the webinar series. Sorry I can't be there in person, virtually, or physically.
Presentation. So we'll just go to some questions. So any questions in the chat or any comments? And then if not, then we'll move on to the panel discussion.
Okay, so we have a question from June. She's asking Dr. Armstrong, do you take 60 minutes daily? She's, I believe, asking about the minutes of workout daily.
Yes, I have stated it, but I know Dr. Morris, she had in her presentation provided the recommended amount of time, and Dr. Morris can clarify on the recommended amount of minutes for exercise for adolescents per day.
Okay. Thank you.
Right. For children and adolescents, it is indeed 60 minutes daily, moderate to vigorous intensity physical activity, mostly aerobic. Okay. 60 minutes every day.
Thank you so much. Any other questions in the chat? Any other questions?
Yeah, we have a couple of more. So Janique is asking, why is inactivity still on the rise globally?
All right. So Dr. Armstrong or Dr. Morris, you want to take that?
Dr. Morris, you wish to go for it?
Mike.
You're muted.
Audrey.
I think maybe by the end of the webinar, we might see why, because we have so many interesting presentations that I think that will bring it out. But it has to do with what we would call some of the advances we have made in transportation, for example. So people no longer have to walk anywhere. You know, they drive there. They no longer play games, if you're talking about children. They don't go outside, you know, they're sitting in front of the screen, whether the screen is a computer or a TV screen, or they're sitting on their cell phone. So there are so many things that come into play that, you know, that's, I would think that sums up some of it. I don't know if Dr. Armstrong has anything to add.
No, I would agree and just say that some of it has to do with our socialization, especially when you think of girls. From the time they hit a certain age, they're more concerned about beauty and concerned about excessive sweating and other things. So they're less likely to engage in physical activity. And then that translates to when we get older, we're still concerned with the beauty and looking a certain way. So sometimes we don't engage in physical activity unless we recognize it's a benefit, because then we look more beautiful. So there are some aspects of socialization that impact our decision making when it comes to physical activity. But of course, I think someone mentioned about workload, and sometimes there are things that impinge on our ability to do that. But when we have a habit, we find ways of working around it.
Mm-hmm.
Wonderful. Thank you so much. So any other questions that have come?
Someone made a comment about the physical activity about kids. It's saying parents are too busy working and they don't have time to spend with their children. So what do you think about this?
I'll start. That's where we have to be very creative in how we approach this. It's playing is important, not just for physical activity, but learning for children. And it means as adults, we have to make it a part of our schedule. We have to make that choice. You have to determine, yes, this is important. If you don't determine it's important, it will get pushed aside, because yes, we are very busy people. And we have to find ways of integrating the exercise where possible. This you need to be creative and consistent with it. And I'm sure Dr. Morris has some more.
Mm-hmm.
Yeah, I wouldn't add anything. I think you've covered it.
Mm-hmm.
Yeah. It's a matter of priorities, and also, you know, as I did mention, I think we have to have an environment that is conducive to physical activity for all ages.
Mm-hmm.
Great. Any other questions? think I see.
There is a question that says, this is from an anonymous attendee. It says, good evening. I'm wondering, learned more about how programs like Jamaica Moves in schools may be able to help children transition some of those behaviors to adulthood when things like work factor into their days.
That's a good question. As you said, it's about habit forming. When you have physical activity as part of your daily activity, you generally tend to try to maintain it, even if you, as an adult, have some issues in terms of time schedules. You usually find you trying to reintegrate it into your lifestyle. So because you started that way as a child, you find that is more likely for that to continue. I guess it's easier for boys as compared to girls, but you'll find that older boys tend to keep their physical activity going, and we have to find ways of being able to help build that habit within our children. And the schools play a major part in doing that.
Wonderful. Thank you so much. I think I saw a question about disabilities.
Yes.
Okay, go for it.
Yeah, someone says, what if a person has a physical disability? How long? I guess this person, Cranine, I think is the name. She's asking how long this person have to do exercise or workout.
All right, there are WHO recommendations for that, and I'll put it in the chat, but there are also recommendations for person, and of course it's going to depend on what the disability is, but the WHO recommendations do take disabilities into account, and I'll give you the exact information very shortly.
Great. That's really helpful. Thank you so much.
Mm-hmm. I'm sorry to cut you.
Go ahead. I was just saying that we are getting lots of questions now, I see. Go ahead.
There is another question from Carissa. It says, do countries now have to develop a physical education or physical activity policy?
So, Dr. Armstrong, I'll see. Do you want to take that one?
Okay, I thought I saw Danielle. So it is Danielle. Yeah, I thought she was going. Yeah, but I can start. It would be important for you to have some documentation, because when you have documentation, it helps to improve the likelihood of implementation, and not just to have a plan, but it should be integrated with all the other plans that you have. Noting that physical inactivity is a major risk factor for NCDs. It's important you have some documentation that states how you will address physical inactivity, noting that is a major problem within our Caribbean countries. I would recommend that, yes, you should have something that speaks to it, even if it's not a document on its own, but it's part of your overall approach to addressing NCDs, especially when we think of our young persons within our communities.
Wonderful. I think also Danielle wanted to also provide a reply to that. So Danielle, if you would like to, over to you.
No, nothing further from me.
Okay, great. So Romina, any other questions? I think we have lots.
Yes.
We also do have to wrap up the questions soon as well.
Okay, so we have 30 seconds left. So one more question.
Okay, let me see. It says, is there guidelines to length of class sessions before allowing students to stretch or do some physical activity to break up block periods of class?
Good question. So I don't know. So Danielle, do you want to jump in there, or Dr. Armstrong? Really quickly, as time is just ended for us.
So I'm just going to say quickly, if you use the Jamaica Moves example, they do have in their approach breaks between classes. It is very important for the children to have that circulation going. So yes, breaks are part of the process, along with the physical activity at structured physical activity as part of the curriculum. Very short answer. Of course, there's more to it.
Yeah, thank you so much. Thank you. So thank you so much to Dr. Morris and Dr. Armstrong for their presentations, but also for being very generous with their time in terms of answering all the different questions. And so now we're going to move on to the panel discussion, and I'm going to hand over to my colleague, Danielle Walwyn from the Healthy Caribbean Coalition, and we're going to have a really interesting conversation about innovation and physical activity. So over to you, Danielle, to take over.
Wonderful. Thank you, Abby, and many thanks to our colleagues who would have been presenting and to all of you for your comments and questions in the chat. Let's keep those coming. So as Abby mentioned, we're now shifting into our solutions, innovative solutions aspect of the webinar. You would have already heard kind of a context setting of where we are, and unfortunately across the region we're not doing so well when it comes to physical activity, and we really do need to start thinking strategically or continue thinking strategically about how we want to address physical inactivity, particularly among our young people. And so it is my pleasure to welcome our panelists. So you already met one of them, Abby Bejo, who's the program director at Lake Health and Wellbeing. So we're happy to have Abby. I'd also like to welcome Dr. Jane Noel. She is the chair of the Chronic NCD Commission in Grenada. And then we have Dexter Fayal. He's a registered architect and director at Awe Architects Incorporated. So as I mentioned, we have a really good foundation, and I'm hoping that everyone appreciates the scope of the problem. And so throughout our panel discussion, we are going to be talking about community-based solutions, and then we're going to expand to the environment, and then we're going to expand to systems level change. So very much aligned with WHO guidelines on how we should be looking at addressing physical inactivity. And so with that, we're going to get right into it, and I'm going to hand over to Abby. And Abby, my first question to you, how can creativity be leveraged to promote physical activity among young people? And can you share some examples of innovative strategies that have been effective? Abby?
Oh, wonderful. So hello, everyone, again with a different hat. So I'm now a panelist. So thank you so much for the question, Danielle. So I think, creativity is so important when we're thinking about physical activity and trying to promote physical activity amongst young people. I think when we use creativity, it can really help us reframe physical activity from just being exercise into something that's fun, it's social, it's meaningful. And I think it can make physical activity feel less like a chore, less boring, and more like something that young people would like to or would want to do. So, and I think that's in essence what we want. We want young people to be excited about physical activity. And the only way we can do that is through creative approaches. So I think, we have to look at how we can use both our rich culture in the Caribbean and the interests of young people to promote physical activity and to do that in new and interesting ways. So how can we use music? How can we use dance? How can we use the beautiful natural environment that we have? How can we use gaming, social media, technology to develop programs that young people are excited to take part in? And then, as I mentioned in my opening remarks, though, we must really ensure that whilst we're being that creative, that we also consider how we can make physical activity more inclusive. And to be honest, that requires creativity. So how can we ensure that young people with disabilities, boys, girls, those from different socioeconomic backgrounds can also participate in physical activity? That takes a creative approach. And then just generally, a lot of young people don't like traditional sports. They're not athletes. So how can we create something creative so that they can get involved in sports? So I think having a creative, inclusive program of physical activity is so important. And to be honest, to get there, we actually have to involve young people in the design and the implementation of these physical activity interventions. And really, we need to tap into their creativity and their fresh ideas in order for us to be successful with that. And then I think finally, we as Caribbean people, we're just fantastic storytellers, humorous storytellers. So how can we create compelling narratives and campaigns that inspire action? How can we use relatable role models, real life stories, engaging content to shift perceptions and show that being active is achievable, it's enjoyable, and actually it can be part of everyday life. And all of that requires creativity. And so these are some of the many ways that I think we can leverage creativity and innovation to ensure that we can target young people and just get them active. But to answer the second part of your question about examples, I can share 3 examples from the work that we've been doing. And if you just permit me to just share a few little slides in terms of pictures, which I think is always nice. So let me just quickly share, just to give you a flavor. So the first example that I have for you all is a project that we did called Shake It Out. And you might notice a very familiar face there. So what we did in this project was using animation to try and promote physical activity in young people. So we created a short movement break that uses animation combined with a real person called Danielle Warwin. So we combined physical activity of a real person and integrated a character. And so this is a creative way of engaging young people when it comes to physical activity. So this is a short animated movement break that we designed to be used in the classroom. So it could be used at assembly, it can be used after classroom. I think someone in the chat had mentioned, something about after class is what's the length of time. So after a class, you could use this short animated movement break to get young people nice and active. And so it's just a nice creative way. We've used music as well. So we also, our creative director wrote the song that goes with the animation. So we've used a song, we've used animation as a creative way to get young people active. And this can also be used not just in the school environment. It could be used in the home environment. It can be used in the community. So if you're having a camp or something, this again, to break up sedentary time, this is something that could be used as part of that. So just to acknowledge that this was made possible through a Creative Caribbean grant. And again, that sort of highlight that we do need the funding to implement some of these creative projects. I'll also just like to speak about our Your Sweet Enough Dance competition. So that's another creative way that we use to get young people active. So although this campaign initially was the core of this campaign was really about healthy drinking and encouraging children to drink more water and the public to drink more water and to reduce their sugary beverage consumption. What we also did was we used it as an opportunity to get children active. So we had a dance competition. So young people had to come up with a dance to our jingle. And so, which meant that for a month, they were regularly practicing and moving and getting active, and it was fun. And so we really integrated dance and movement into this campaign. And that was a really effective way of getting young people moving. They had fun. They got some good prizes. There was friendly competition. The teachers got involved. They did it in groups. They did it by themselves. They did it in pairs. And it was a really nice way to really promote physical activity in children. So we used dance and we used music. So in the first case, we used animation and music. And in this case, we used dance and music. And we had good uptake. So we had 13 schools involved, 79 participants, 28 video submissions. So again, another interesting way to get young people active. The final example I'm going to give, although this is healthy eating, I'm just sharing it for the concept. So we created a healthy eating video game, a computer game. And this computer game was teaching children about healthy eating. But I think we can use the same concept for physical activity. So this was really interesting. So again, this was developed through a Creative Caribbean grant. And really, kids loved the game. They were having a blast. We would go to health fairs and kids would be coming to our information table, playing the game. And in one case, a young child abandoned his parents and stayed with us for hours while he played this game. And then unbeknownst to him, he was learning all the concepts. He was learning how to create a healthy plate. He was learning what was unhealthy and what was healthy. And all the while having a really good time. So I think we can use this as well in terms of concept, using computer games and gaming to also promote physical activity. So those are my 3 examples on how we can sort of leverage creativity and innovation to promote physical activity in children. And I believe I'm way over my time, so I will hand back over.
No, that's okay, Abby. That's brilliant. And one of the things that you centered on from the very beginning of your intervention was that we have to ask the young people. We know that the rates are low, and I think it's important for us to ask the young people, meet them where they are, and you have done that in such a creative way. So kudos to Lake Health and Wellbeing. And I liked also your reflection on meeting young people where they are, plus also thinking about how we can reflect and embrace our culture, plus thinking about storytelling. So really, again, on that innovative side. And with that being said, Abby, I'd also like to hear from our participants. I know we have colleagues from across the region who are implementing various physical activity initiatives, so feel free to share your various programs in the chat. But thank you, Abby. We're now going to zoom out a little bit. And Dexter, I'm going to turn it over to you. So we just heard about Abby. We heard from Abby about some specific programs that can be implemented, again, informed by young people, by young people. Now let's think about our environment. So the WHO emphasizes shaping environments to make physical activity more accessible. So what are some impactful examples from across the region where environments have been designed or adapted to support active living? Or can you suggest how we can build the environment to promote physical activity? So Dexter, over to you.
Thank you very much for the question and good evening to all. Thanks for having me here this evening. Allow me to share my screen. 1 second. Share. That's it. Are we live?
Almost.
Almost. Should be.
There we go. Over to you, Dex.
Okay. Good evening again, and thanks for the questions. The short presentation is titled The Footprint of Movement, and specifically it takes a look at the intersection of architecture and physical activity, right? So I think we all would appreciate that movement is not only defined by, it's not an individual choice, but movement is also dictated by our built environment and the environments that we inhabit. Yeah. So first of all, I want us to take a look at the picture from an urban scale. Physical activity begins with equitable access to high public infrastructure. Well-designed public spaces encourage daily, spontaneous movement, turning ordinary commute into an active experience. If you look over to the left, you would see the sole of that foot represents what we consider to be the urban interventions. So to your question, I have itemized 3 examples, and of course we're not limited to those 3 examples because there are several there are several examples spread out through the Caribbean. But for the purpose of this presentation, we're going to limit to 3. First of which would be the Emancipation Park in Kingston, Jamaica. And then we have the Barbados Boardwalk and Cayman Bay, Cayman Islands, right? So briefly, we're going to analyze and take a look at what the key features of each one of those would look like. So of course, we have this loop track that allows for, of course, walking, jogging, and the likes. We also have the design also offers some level of safety as well. As we would see in the next slide, there is nocturnal use of the spaces as it is well lit and it encourages physical activity beyond the daylight hours. We have open lawns, and of course it's a central urban location. As we could see here in some of the photographs to the left, we can appreciate the younger individuals utilizing the space. In the middle here, we have sort of an overview of the park, and we can appreciate the fact that it's multi-use. It allows for a clean palette so as to allow the occupants to utilize in the best way possible. Interestingly as well, we look at the public, I would say the urban furniture. We do have one very, very static, and I think it was deliberately designed to basically command the attention and allow for allow for greater interaction, right? Moving over to Barbados, the difference here is that it offers what is called a coastal experience. So we do have how should I put it? We do have physical activity, we do have access, we do have circulation along the coast, and I think options are very important. The more options that we provide for physical activity, the more we reach the demographics and the different individuals that can benefit from the level of physical activity, right? And again, we do have some reference photographs, just briefly, of the boardwalk. And then we have Kimano Bay. So this one is similar and different at the same time. It allows for a level of interaction and I would say physical activity within the urban fabric that is also, how should I put it? It's interwoven into what is called the commercial district as well. So it allows for the possibility for one to navigate through the stores and at the same time partake in leisure and other forms of activity. I think we could see here, moms are strolling with the younger ones. And of course, we have some form of physical activity identified in the bottom. So quickly, we look at the continuum of movement. At the domestic scale, we appreciate that while urban environments enable movement, the home environment reinforces or discourages daily habits. And that's a very important point to highlight. So briefly, I'm going to make some quick observations and recommendations at the same time. We must first establish that architecture really shapes and it does play a part in providing comfortable spaces that become usable spaces, right? So just briefly again, we look at architectural enablers in terms of how we orient our homes to take advantage of the prevailing winds to ensure that the spaces that we create, are spaces that really allow us to be part of the space and to maximize and use it to its fullest potential. Strategy number 2, what I consider to be the consolidated veranda. So in this example, I'm sure we can appreciate that oftentimes we see homes that are arranged in such a way or designed in such a manner that we do have very small balconies, and the balconies are usually unusable, right? One of the strategies would be to sort of consolidate some of the smaller balconies. So in essence, we have less balconies, but the balcony spaces are more usable multi-use spaces. And again, that I believe would encourage further activity and greater physical activity in its own right. Define but open boundaries. Verandas serve as active social hubs but blur the boundaries between domestic and natural environments. So in this example, there is the consideration to strategically remove railings where possible, where the topography allows for it at the ground level, paving the way for the spaces to become a little more open, a little more welcoming, number one, and allowing for how should I put it? For greater utilization, right? Number 4, we have the ground connected balconies, minimizing the level changes between exterior floor and ground level. Here we can appreciate the fact that the ground level is at the patio or the deck is pretty much at the same level with the outdoors. Now I do have to emphasize this is not always possible owing to the topography, but where possible it allows for the maximization and the expansion of the space. And finally we have the activated rooftops. This has been a very common practice here in St. Kitts and Nevis, and I appreciate as well in other parts of the Caribbean, where there has been an uptick in rooftop terraces. As to how much these spaces are actually utilized, I am not sure. But I think when we consider the cost of land, I think it would be useful for us to sort of leverage and utilize the rooftops as much as possible, specifically as it relates to greater physical activity, right? And this takes me to the end of the very brief presentation, and it says design for movement. If we design for movement, we design for healthier generations. So I suggest that we keep on moving. Thank you very much.
Yes, Dexter, well said, well said. And talk about innovation. I think everyone is going to look at their balcony a little differently, perhaps after that presentation. So thanks, Dexter, for encouraging us to consider how we orient our homes and then taking it to your examples that you provided. I'm hopeful that those are examples that people are familiar with. I wanted to flag the Emancipation Park. There's actually research done on the use of that park and particularly how beneficial it has been for women because they feel safe. It's well lit, all the things that you acknowledged. And then just personally, the boardwalk in Barbados is one of my favorite places to be active. And I imagine that might be the same for other people as well. So thank you so much, Dexter, for that. And again,
You're welcome.
Yeah, I think it's gotten people, I'm hoping that it's gotten people thinking. Sybil saying it's an interesting presentation. All right.
Just
Yeah,
a
go
very
ahead.
quick intervention,
Sure.
if you would allow it. I think after or during COVID-19, I think it gave us an opportunity to really do some introspection with regards to our homes and our spaces, specifically when most persons were really confined, in place. I think it really gave myself as an architect as well, it gave me an opportunity to evaluate the space that I occupy. And I think verandas, balcony, exterior spaces, sort of bringing the outdoors in, I think is very, very, very important. Yeah, so I just thought I would highlight this one.
Yeah, well said, Dexter. Well
Okay.
said. And you're getting some applause from the audience, which means it resonates. So thank you. All right, so we're moving even further. So another layer where we're looking at active systems and really the systems that help to support all the physical activity interventions. And so Jane, turning it to you. So promoting physical activity requires a whole of society approach. And we heard that from Gloria, and we also heard that from Dr. Armstrong. How has your NC Commission collaborated with partners while managing conflicts of interest, so ultimately prioritizing partners that focus on people and people's health at the heart of their work to create supportive systems and structures that normalize physical activity? Jane?
Well, thank you, Danielle. And it's interesting. Before I came on, I was looking at what PAHO has to say about activity. And I think we have to remember that physical activity isn't now just a traditional PE, which is what we used to think. It's like, it's physical, it's mental, and it's socioeconomic. So it's exactly what it's saying. It's physical activity, but physical activity is so important for mental health, especially for children now. And it's the quality of it as well, that everyone should have access to it. So from our point of view in Grenada and our commission, I think our key thing is that we know that collaboration is key. We cannot do everything. So we have to have partners right from the highest level to the lowest level. And you have to have key stakeholders to make anything work. So we had worked on a childhood obesity policy that we're just now waiting to be finalized by Cabinet. But one of the key areas of that is physical activity. And so we started enacting that even before we've got final approval. And so we realized that one of the most important stakeholders is the Ministry of Education. So we start at the very top. But it's the ministries tend to work in separation from each other. So to try and bring this concept of bringing the ministries together. So we are kind of acting as a bit of a catalyst, I hope, to bring people together. So we've had meetings, and we've been having constant meetings over the last 2 years, bringing Ministry of Education, Ministry of Sport, and our National Sports Council, which is very important because that goes out into the community, to bring them together to look at strategies, how we can use policy that already exists, but how we can build on it. So we've been looking particularly at what we call physical literacy, which is potentially a new concept to some. It's an old concept to me. It was just under a different name when I lived in the UK. But it's this concept that sport is not just about competitive sport. It's about enjoyment and movement. And it's trying to become literate for life. So you're starting with a small child and moving right to grandma and granddad and people in their 90s, the fact that they can still be moving at that age, as in fact my mother is. She's still gardening at 94. So it's like it's physical activity for life. So we are trying to bring that into schools in Grenada and into the general population through the National Sports Council, and then moving into the parish sports councils to bring this concept. So part of that is also making the activities fun. We've been going into the schools because the kids are in school for so much of their life that environment has to be conducive to health in all aspects. So we went in, and the kids are now doing Friday dancercise. So instead of having their normal, the normal meeting where the school assembly, where the children don't sit still anyway, they now go out and dance quite a lot of the schools. For that period of time, that has now been turned into dance. And we went and danced with them. Then in some of the schools, we've brought in back skipping. So we donated skipping ropes. And the PE teachers have vowed that they will have every child in the junior schools learn how to skip. And we went and we challenged the junior school children to a skipping competition. So at the age of virtually 60 now, myself and a friend of mine went in and we beat all the children in a skipping competition, because that's what we did as kids. And it comes back. I hadn't skipped for a while, but it comes back. So they were horrified. So they invited us back for a rematch where we kind of tied. They improved tremendously. So they're having fun. They're out so we're trying to bring that in more and more. I see my time's up and I've not even spoken. Can I have 2 more minutes? 2 more minutes.
Yes, great.
Something that we've been doing. Another thing is also then partnering with Ministry of Infrastructure, like you were saying, Dexter, to have safe environments. So the concept of having either closed roads or areas that can be used on weekends where cars aren't, for safety, that we're finding difficult, but we're still pushing for that. And then you've got NGOs. So we've got, for instance, we've got Rotary that we work with, who are dedicated to childhood obesity. And they've set up a walking track in Quarantine Park. And so that's now a safe space. And we're hoping that that model will be translated across Grenada. We're also involving the denominational schools. So do not ever forget the power of our religious entities. The Caribbean is a very religious entity in itself, and the church has an extremely powerful voice when it comes to anything. So we started small, but we are now looking to educate teachers, because we have to lead by example. So we have to lead by example by the teachers, because children emulate whatever adults do, the good and the bad. So the moment they're emulating the bad, right? So we are planning November to bring all the denominational school teachers together for their health event, looking at their spiritual, their mental, and their physical wellness, and to try and get back into this vocation. Like, teaching is a vocation, and that means that you are leading by example. And so what the hope is that will permeate to the children, and then we're going to move to the PTAs and involve the parents to try and get that message across. So that's what I would say. You have to work in all the different aspects. And we also have an NGO who they have over the last 4 years taught 10,000 children to swim in Grenada. And, that's the Youth Adventurers, and it's the Get Grenada Swimming. I'm hoping we can partner with them as well, because we have water, and swimming is one of the healthiest activities a child could do. But they now are targeting the parents, so that parents can't swim in Grenada, right? Which which is, you know, a lot of parents can't swim. So it's bringing the mums and the dads to the beach with the kids and giving them free lessons as well. And, you know, the aim is by 2027 to have 100 new fully qualified professional swim coaches in Grenada who will be at these sites. So there are so many different aspects. It's just trying to tie things in so it's an overall message. So that's strategies, you know? Yeah. And the conflict of interest, yes, is difficult. We all know that sponsorship comes through sugar sweetened beverage drink companies and everything, but it's navigating the least bad, if I was to say, and looking at ways to protect our own interest, but being able to support events. Yeah.
Thank you, Jane. So you took us through and reminded us of the fact that partnerships are critical. I just want to reiterate some of the partners that you mentioned. So you're within the Ministry of Health, but you acknowledge, especially as we're talking about children, we need to involve the Ministry of Education, religious institutions, parents. I also like that you have the National Sports Council, but also the parish-based sports councils, which I know is probably not a norm in other countries, so that's excellent. And having everyone sing from the same hymn book, essentially. When you were describing the skipping rope, it made me think of an opinion editorial that Off Neil, who gave opening remarks, and Kayla, two of our Healthy Caribbean youth members, wrote for World Physical Activity Day, and the title was "Let the Children Play."
Exactly.
You know, and so that your comment made me think about that. So I know that we are pressed for time, so I'm gonna turn it over to Romina to see if we have any questions. I think I see two. And then I have a closing question.
Yes, there is a question that says, who do you think we should target first? Physical planning for infrastructure to ensure safe space for physical activity, or Ministry of Education?
Both at the same time. Yeah. If you wait for one, you'll never get anywhere. I feel like we just seem to be doing a whole load of things all at once, and gradually they're beginning to lock together. You know, I don't think you can have one without the other, to be honest.
Yeah, I agree. I think we need both. I mean, I think Ministry of Education is so important on so many levels in terms of educating children about the importance of physical activity, but also providing the physical activity opportunities. So we definitely need to engage the Ministry of Education. But physical planning, I do think should be a priority, because I do think a lot more work needs to be done to make sure that our physical infrastructure does facilitate physical activity. And I think maybe we are lacking in that area. And so I think maybe quite a bit of attention on physical planning is needed. But I can defer to Dexter, who will probably be able to give a better answer around the physical planning side. But I do think we need more attention on that side so that we can have more sort of spaces for physical activity. Because just personally, I think a couple of months ago, my husband was trying to go cycling, and, you know, no cycle lane. You know, he even felt it was really quite dangerous. So I think all that kind of physical planning, it needs some kind of attention.
Great, thank you both. Romina, any other questions?
I think I see one more question in the QA. It's a little bit long, but I'm just going to give you the question. It says, how much of a role, if any, could data or the lack thereof be impeding our march forward? For example, do we have robust outcome data from programs like Jamaica Move or SKN Move that clearly demonstrate impact at scale? Is asking.
It's a good question. Open up to any of our panelists, or even any of our previous panelists.
I think, if I may, I think definitely this is a reasonable question and a very important question. Any informed response or any reasonable response to a solution obviously relies heavily on data. And as architects ourselves, That type of data is pretty much important. So if any one of you guys do have an opportunity to interact with the individuals who collect the information, I think it would be instrumental to allow that information to sort of reach us as designers. So indeed, it's a very important, very important question, very important topic.
Thanks, Dexter. Dr. Armstrong, did you want to add anything there?
Yes, I just want to say under the Caribbean Moves Initiative, one of the key pillars is monitoring and evaluation. Trying to understand how do the health promotion initiatives make a difference in terms of the risk factors such as physical inactivity and healthy eating. So certainly countries as they join the Caribbean Moves Initiative, they're encouraged and supported in building monitoring evaluation frameworks that will allow them to understand what is the impact of the work they're doing. So yes, that's the direction we're heading. And with partners, I know that we will be working hard to implement that framework across the region.
Great. Thank you, Dr. Armstrong. Okay, we've come to the end of this portion. I do want to ask, bear with us, I know we have just a few more minutes left, but in a few words, I just want to ask our panelists as a closing thought. So the WHO has set a global goal that we really want to reduce physical inactivity in adults and adolescents by 15% by 2030. What does a more active Caribbean look like to you in 2030? So it could be one word, it could be two words. What does a more active Caribbean look like to you in 2030? Abby, do you want to go ahead?
Can I go first?
Oh, Dexter, sure. Go right ahead.
Yeah, so I think it should look like it ought to be a place where we do have more urban spaces, well-designed urban spaces that allows for a multiplicity of users from all sectors. I do think that we have some work to do in that regard. The infrastructure needs to be there. I think there's a willingness to do so, but of course everything is driven by budget and the likes. So I do think there's an opportunity for us to have. Quickly in closing, I was trained in Cuba, and one of the things I appreciate from Cuba is that almost every corner that you interact with, there's a park. There is something that would allow you to engage in physical activity. Yeah. And I think that in the Caribbean, I think we should aspire to same. Thank you very much.
Thanks, Dexter. Jane, over to you just briefly, and then Abby.
I would like to see teenagers not forgetting their gym kits and not bringing letters from home, excusing them from physical activity, but especially our girls, but actually wanting to take part in the physical activity school. That's what I would like to see.
Thanks, Jane.
It used to be like that a long time ago.
And I think the shift can happen, and it goes to Abby's initial comment about really engaging young people and seeing what exactly they would like to do and explore to be more active as well. Abby, you want to close us off?
Yeah, I think I would just like to see like an environment where everybody has access to a physical activity opportunity. So whether you're old, you're young, whether you have a disability or not, whether you're a girl or a boy, whether you're low socioeconomic status, high socioeconomic status, everybody has access to physical activity opportunities. And for us to just, I think, almost go back, maybe it's not even the creativity, but I think what Dr. Noel was saying, going back to basics of active play. So having active play opportunities as much as possible when they're birthday parties, when they're social events, making sure that children are not on their devices, but they're out there getting their hands dirty, getting active, and just being kids and just enjoying themselves and running around. So I think just a society where we're all happy and have these opportunities to get active and feel safe. So that's me.
Beautifully said, Abby. Let the children play. So with that, everyone, I would like to close today's webinar. I want to thank all of our presenters, all of our panelists, our audience members, our partners, so Lake Health and Wellbeing, the Healthy Caribbean Coalition, CARFA, and PAHO for bringing us here. our behind the scenes crew, Romina and Akshana, for your support. And I think over the webinar, we got a good understanding of the reality. Things are not great for us in terms of physical inactivity, but there have been a lot of ideas shared. There's a lot of work that's going on, and a lot of potential. We heard from Gloria Giraldo, who mentioned that the most effective interventions are multi-sectoral, and we know that we're already investing in those. Dr. Armstrong mentioned that every dollar spent in physical activity can be seen as an investment case, so that need for us to really put the money behind all the interventions and ideas that we have. And I want to just end with one thing that Dr. Giraldo said, which is move, thrive, and live well. That's really what we want to see. So with that, I am pleased to close this webinar. Thank you everyone again for coming, for your interest, and we're looking forward to sharing the recording with you. Just to note that we will include Dr. Hospidalis's presentation in the recording, so you will still have access to view his presentation. Thank you, everyone. Take care and have a good night.
Great. Thank you. Bye, everybody.
Bye.
Thank you. Bye.